Hi, I'm Aldo, one of the anaesthetic registrar working at Ashford and St. Peter's. On the day of your surgery, you'll be asked to arrive on the ward before the expected time of the procedure. The main reason for this is so you can meet your surgeons and anaesthetists before they start working in the operating list. Once they start, it can be very difficult for them to leave again until all the patients are safely awake. On arrival on the ward, you'll be shown to your bed. A nurse will come and then do your admission paperwork. This involves some questions. They will also want to measure your height and weight and do some what they call observation. These will be repeated several times before and after your surgery. These included taking your temperature, using a ear thermometer, checking your blood pressure with a cuff around your arm, and measuring your oxygen level and pulse using a pulse oximeter. This is a small clip they space around your finger. Nail varnish can affect the accuracy of this monitor, and is one of the reasons we are asked to come to the ward without nail varnish or acrylic nails. You may also be asked to provide a urine sample. It's a good time to bring something to do, as there may be some time waiting around, depending on the time of the operation and how many other people are in surgery on the day. Your surgeon will come and meet you before your operation and will explain the procedure to you. They might want to do a quick examination. They will then ask your parent or carer, or yourself, if you're age 16 and over, to sign a consent form agreeing to the operation. Your anaesthetist will also meet you before your operation and will discuss your health, discuss you which type of anesthetic is best suitable for you, and discuss with you the benefits, risks, and any preference that you may have. Nothing will happen until you or your parent or guardian understand and agree with what has been planned for you. An anaesthetist stays with you all the time, while you're unconscious, and continue to give you drugs to keep you anesthetized. During your anesthetic, you may have dreams, but not everyone do so. As soon as the operation is finished, the drugs will be stopped or reversed so that you quickly regain consciousness. When you're called for your operation, a member of staff will go with you to theatre. A parent or a carer will be able to go with you to the anesthetic room. You will usually be asked to wear a hospital gown or pyjamas to go to theatre, or you may be able to wear your own clothes. Choose something loose and comfortable. They will be easy to wash afterwards. You can wear your glasses until you're in the anesthetic room. Jewellery or decorative piercing should ideally be removed. If you cannot remove your jewellery, it can be covered with tape to prevent damage to it or to your skin. Your anesthetic will start in the anesthetic room. In the room there with you, there will be a parent, a carer, a nurse or play therapist from the ward, your anaesthetist, and an ODP, or operating department practitioner, or an anesthetic nurse. If you will be happier with less people in the room, please let us know. Theatre staff will check your identification bracelet, your name and date of birth, and will ask you other details. The staff will remove the dressing from your hand, or you may be able to do it yourself if you prefer so. Certain monitoring equipment will be used during your procedure. The theatre staff may want to connect the monitoring while you are in the anesthetic room before you go to sleep. The ECG, or electrocardiogram, is connected to you by 3 sticky dots on your chest. It continuously monitors the electrical activity of your heart. An ECG can detect changes in the speed or rhythm of your heart, while the pulse oximeter will be placed on your finger and the blood pressure cuff on your arm. The safest and fastest way to deliver anesthetics will be to inject drugs through your cannula. A cannula is a thin plastic tube that is put into your vein, usually on the back of your hand. You will be offered local anesthetic cream, which will be put on your hand or arm to numb the skin before you have the cannula. The ward nurses will be able to do this for you. A small needle is used to put the cannula, and then the needle is removed straight away, but because of the numbing cream, this should not hurt. Once the cannula is in place, your medicine can be given through it without using any more needles. Your cannula is usually left in place after the operation, just in case you need any more medication. In certain specific scenario, or if it's better suited, you can also breathe anesthetic gases and oxygen through a mask, which you may hold if you prefer. You can start anesthetic this way. Your anaesthetist will place a cannula once you're then unconscious. Why do you need a cannula after breathing in your anesthetics? Although your anesthetics you breathe will keep you unconscious, you may also need other medication, and this can be delivered through the cannula. Example, these will be pain relief medication or drugs to help you muscle relax completely during surgery. The anaesthetist will then give you the anesthetic in the way that you have agreed with them. Your parent or care will stay with you until you asleep. When you wake up, you will be in the recovery area with nurses looking after you and repeating your observations. A nurse from the ward and your parent care will then arrive to take you back to the ward. You will still feel sleepy, so you will be taken back to the ward on a bed. Once you're back, you can have sips of waters, and when you feel ready, something to eat. You will need to be eating, drinking, and be able to go to the toilet before you can be discharged out. Your nurse will be able to tell you after your operation how long you have to stay on the ward. Before then, you can go. Just before you go home, the nurse healthcare assistant will remove your cannula. This will feel like taking a plaster off. Your nurse will give you any paperwork and explain any instruction you'll need to follow after your operation.